Okay, I know that I'm one of those folks who like to talk out to you and like get responses back. I grew up in the black church. It's kind of hard for me not to do that. So just know that that's going to be a part of this conversation. It really is an honor and a privilege to be able to share with you all today and to kind of zoom out from this conversation, because this part of the day we're talking about like how community and public health perspectives on postpartum services and access, and just getting it from a different, I'm not a doctor, I'm not a lawyer, I'm not coming to you from that perspective. I'm an organizer. We represent an organization and a national collective of women of color all over this country who are doing work called reproductive justice. And so as I'm here to kind of talk about what equitable care and outcomes for moms look like, it was really important, I thought, for us to bring into this conversation what the notion of reproductive justice is and what intersectionality looks like, because those principles and that framework is really crucial and imperative to us to hold and understand if we're working with different types of communities, different types of people, and helping them get the actual care and the services that they need. So what is reproductive justice? How many folks in the room have heard of reproductive justice? Anyone? Yeah, look at this room. Y'all are so smart. I love it. And that's great. I'm glad that most people understand the concept. But for those who don't, reproductive justice was kind of birthed by black women in 1994, about 20 years ago, whenever there was this conversation happening around healthcare reform. And what does it look like to center the most marginalized communities, which so many times get knocked out of conversations or kind of excluded from conversations about care and access and health, right? And so these black women came and they were like, okay, it's really important for us to understand that we don't want to get lost in the conversation, so how do we make sure that our issues are centered? And because of that work, they combined this work of reproductive health and rights with social justice, making reproductive justice. And they rooted this framework in the notion of intersectionality, understanding that communities of color and the most marginalized communities are coming to us dealing with multiple layers of oppression, working in their lives at all times. They're also coming with multiple layers of identities that cannot just be pitted against each other or excluded whenever we're not really ready to talk about particular pieces of their identity. For instance, today, I've been hearing a lot of conversations and been a part of a lot of conversations around this topic, and it's been very heteronormative, right? When we talk about sexuality, are we extending that to also talk about same gender loving folks, right? Are we talking about the trans community as well, right? So there are many different types of people who parent, and there's many different types of people who give birth, and many different types of people who need different types of things after they give birth, right? So that's what reproductive justice, the framework, is about, and that's what intersectionality is, and why it's important for us to center that whenever we have these conversations, especially talking about what type of care is necessary after individuals give birth. And so I want to root this conversation in kind of a case study of what we've been involved with at SisterSong, which really put us very, very much in the middle of this conversation around postpartum work. And so our keynote speaker spoke about this a little bit during lunch, but this whole notion of maternal mortality, right? So we know that maternal mortality is an issue that's on the rise, and what we were finding is that there were women who were, after giving birth, were losing their lives or dealing with serious complications because of birth, and no one was really talking about them. So what is maternal mortality looking like for us in the U.S. today? There's a growing number of deaths and complications to women in pregnancy and childbirth in the U.S., and the U.S. is one of only 17 countries worldwide, and the only country with an advanced economy where the rate of maternal mortality is rising. So between 1990 and 2013, maternal mortality in the U.S. has more than doubled, from 12 to 28 maternal deaths out of every 100,000 live births. But black women in particular, and this is where the work around with SisterSong and the work of reproductive justice advocates, how we really got put into the conversation. Because black women are 3 to 4 times more likely to die from pregnancy-related causes than white women, a ratio that has remained essentially unchanged for the past 5 decades. And black women are 2 times more likely to suffer from severe maternal morbidity, such as heart attack, stroke, or heart attack, shock, blood clot, and hysterectomy than their white counterparts as well. So we saw that black women in the South were very much experiencing this at an increased level. And we brought women together in Georgia and in Mississippi, which is where we saw a lot of the disparities rising, because Georgia is like the state with like the highest maternal mortality, it seems like these days, right? So we brought our women together, these women that we work with every single day on an advocacy level and working to really push past all the reproductive oppression that they're dealing with in their lives. And so we asked them, what did care look like for them beyond their pregnancy? And we didn't just only center it in that particular piece. We also wanted to know what type of, what did comprehensive sex education look like for them? What did they get when they were growing up? Did they even learn what happens with their body during pregnancy, or what happens to their body when they're ovulating? Like, we took it all the way back there, right? Just to see what folks were working with before they even got pregnant. And then we wanted to see, once you were pregnant, what were you getting? What weren't you getting? And then once you delivered, what did that look like for you? And the stories that we got, you all, were shocking. What we got from women on the ground, real-time stories, was that there was so much discrimination, there were so many assumptions put on them, that there were very little moments where they actually felt like they had a relationship with their healthcare provider, right? That they ended up having really hard experiences, whether they did not get proper care, or whether they were dealing with infections or things with their bodies that they thought were normal that weren't. Really, really, really devastating stories that we were able to pull from these women whenever they were able to sit down with someone and talk to someone who looked just like them, and someone who they felt like they would understand their story. And so we were able to compile these stories and partner with the Center for Reproductive Rights to create a shadow report that we then took to the United Nations, y'all. We went to Geneva, Switzerland, because we wanted to make this not just a U.S. issue, but we wanted to create a global sisterhood around this issue, right? Because what we saw, and then the report is called Reproductive Injustice, Racial and Gender Discrimination in the U.S. healthcare system. And what we were bringing up to the Committee on the Elimination of Racial Discrimination. Y'all, we were there at the same time. We were right there on the same time that Mike Brown was shot in Ferguson, right? So to see all of these issues connect with each other was absolutely mind-blowing, right? But we brought it before that committee, and we raised issues around the lack of Medicaid expansion in the South in particular. We raised these stories of these women and how they dealt with this racial discrimination in their healthcare system that is supposed to be providing for them quality care. And what's interesting for us is that although we know that this is a rising issue in this country, there's very little consensus, right? From maternal health folks, from public health folks, from professional service providers on why these issues keep rising up. But what we're really dedicated to getting to the bottom of, and the research that we're trying to do from this community-based participatory kind of research model, is trying to figure out how economics, how race, and how all of these issues that have long historical implications on the lives of communities of color and marginalized communities play a role in what their outcomes look like. So we can't have this conversation, and this is what reproductive justice pushes us to do. We can't have this conversation just about what's happening and what's not happening and what we can do. We have to dig deeper on what are the social inequalities, the historical implications that are also connected to these issues that make it difficult and sometimes impossible for the most marginalized communities in this country to get the care that they need. We can have a checklist all day long and say that we have done everything that we need to do. But if we're not addressing the story behind the pain that a mother is feeling, that's not just attached to what happened in childbirth, but the fact that she's almost about to lose her job because she can barely breastfeed her baby, or because she's missing time from work, because she's losing blood, because she's having a complication after her birth, but she can't say anything to her employer because she's afraid of losing her job. All of those things have to be discussed at the same time. And if, as service providers, as researchers, as social justice activists, if we're not trying to get to the root of those stories and incorporate that into how we have these conversations, then mothers are going to continue to die, and we will not have the healthy mommies and the healthy babies that we want. So thank y'all for letting me bring that perspective into the room, and I look forward to questions.